So in this lecture, we're going to discuss insight therapy. This is a type of psychotherapy where the goal is to expand awareness or insight, hence the name. And there's a few different types. There's psychoanalytic and psychodynamic therapies, which both came from Freud's work, and humanistic, which emphasizes the human potential and positive belief in human nature, as well as encouraging unconditional positive regard. So let's take them one at a time. Based on Sigmund Freud's theories of psychoanalysis, psychoanalytic therapy is a form of in depth talk therapy that aims to bring unconscious or deeply buried thoughts and feelings to the conscious mind so that repressed experiences and emotions, usually from childhood, can be brought to the surface and examined. And it uses analytic techniques to help release repressed thoughts, experiences, and emotions, but it's a modified, generally briefer and less intense version of early Freudian analyses. The therapist patient relationship is central to the healing process, as are the original theories of attachment, which focus on the quality of bonding between infant and parent. Transference, so the transfer of earlier emotions and needs to people and events in the present time, and resistance, the stage of therapy when the client becomes overwhelmed by the release of painful repressed feelings and tries to avoid dealing with them. Eventually, as patients become more comfortable and less resistant to facing their issues and are able to understand their own motives and behavior, healing can begin. Now, according to Freud, the overarching goal of psychoanalysis was to make the unconscious conscious. What on earth does that mean? Well, he wanted to make the patient aware of their previously repressed impulses, conflicts, and memories that were responsible for generating the psychological distress. So, we talked earlier about different conflicts within a person that result in using defense mechanisms, for example. Psychoanalytic therapy aims to clear away the emotional distortion from these past experiences of guilt and frustration and bring to awareness those previously repressed impulses, conflicts, and memories. People with depression, emotional struggles, emotional trauma, neurotic behavior patterns, etc., might benefit from psychoanalytic therapy in theory, although there's not a whole lot of evidence for the effectiveness of this technique today. Psychoanalysis involves six core techniques. So the first is free association, in which patients express themselves without censorship of any sort. Interpretations, this is where the analyst forms hypotheses regarding the origin of the patient's difficulties and shares with them as the relationship develops. In dream analysis, the therapist's task is to interpret the relationship of the dream to the patient's daytime experience and note the dream's symbolic significance. Resistance is attempts to avoid confrontation and anxiety associated with uncovering previously repressed thoughts, emotions, or impulses. And therapists try to minimize resistance by making patients aware that they're unconsciously obstructing therapeutic efforts. Transference involves projecting intense, unrealistic feelings and expectations from the past into the present, often the therapist themselves. And research suggests that we do often react to people in our present lives in similar ways that we interact with those in our past. Working through is the last technique, and this is where the patient confronts and resolves problems, conflicts, and ineffective coping responses in their daily lives. So I have this short video about psychoanalysis. I'm not going to show. You can take a look on your own. Some of it is recap from last week. Psychodynamic therapy also stems from Freud's theories and is similar to psychoanalytic therapy in that it's an in-depth form of talk therapy based on the theories and principles of psychoanalysis. But psychodynamic therapy is less focused on the patient-therapist relationship because it also focuses on the patient's relationship with their external world. So often psychodynamic therapy tends to be shorter than psychoanalytic therapy with respect to the frequency and number of sessions, although that's not always the case. Psychodynamic therapists believe that abnormal behaviors stem from traumatic or adverse childhood experiences. So they try to analyze distressing thoughts and feelings the patient may be avoiding, wishes and fantasies the patient may have, recurring themes and life patterns, significant past events, and they help explore the therapeutic relationship or what's happening in the room during therapy. So, with help from the therapist, the patient is encouraged to speak freely about anything that comes to mind, which should sound a bit like the free association we talked about on the last slide. The goal is to experience a remission of symptoms, but also to derive such benefits as increased self esteem, better use of their own talents and abilities, and an improved capacity for developing and maintaining more satisfying relationships. The patient may experience ongoing improvement after therapy ends. And although short term therapy of 1 year or less may be sufficient for some patients, long term therapy may also be necessary to gain lasting benefits. Psychodynamic therapy is primarily used to treat depression and other psychological disorders, especially among those who've lost meaning in their lives or have difficulty forming or maintaining personal relationships. But again, as with psychoanalytic theory, there's not a whole lot of evidence to suggest that psychodynamic theory is super effective, and you don't see it used very often today. And that's largely because there's a number of criticisms of Freud's work. So, as we discussed before, much of the development of Freud's treatments was based on small samples of wealthy, intelligent women. So there's a lot of issues with external validity and the ability to generalize this work to other populations. The clinical sessions he conducted were not done systematically and they weren't observed by anyone else for reliability. So there was no consistency. It made it very difficult to replicate the therapy. Some critics question how valid our old past memories are, those are a cornerstone of Freud's work. So, if our past memories really hold no significance to our lives, it pretty much debunks all of Freud's work. Research has actually found that insight or understanding our emotional history is not necessary to relieve psychological distress. So, maybe insight isn't all that important or necessary in the psychological healing process. There's also been no evidence to show that hurtful memories are more easily repressed than non hurtful ones. So, Freud and Neo Freudians argued that we all have these repressed memories and they cause conflicts in our lives, and they cause a lot of distress. But in fact, disturbing events are more memorable and are stored in our memories quite well. Remember, we talked about things like flashbulb memory, those aren't repressed at all. And finally, psychodynamic therapies are scientifically questionable and difficult to falsify, which is another major criticism. Now, it might just be that psychoanalytic and psychodynamic therapies are harder to study in the same ways because they tend to be very long term and a lot of back and forth between the client and the therapist. It's hard to plan. It might be difficult to pull away what was a successful session and what wasn't. So there's a little bit less structure than other forms of talk therapy, which might make it difficult to study scientifically. But overall, the general idea is that these forms of psychotherapy are not used very often today. Neo-Freudian therapists are more concerned with the conscious aspects of the client's functioning, as well as recognizing the impact of cultural and social influences on behavior over the lifespan. So, Freudian therapists are concerned with the conscious more so than the unconscious. Neo Freudian therapists acknowledge the impact of other powerful needs, including love, dependence, power, and status, compared to the traditional Freudian focus on animalistic drives like sex and aggression. Neo-Freudians saw therapy as a collaborative effort between the client and the therapist. They felt the therapist should be a participant observer. So, in addition to observing, they should participate in the therapeutic process by giving some of their thoughts back and making it a more interactive effort between the two people rather than just the client talking and the therapist analyzing. Henry Stack Sullivan contended that the analyst's proper role is that of participant observer. So he was a big proponent and influencer of interpersonal therapy, which is a treatment that strengthens social skills and targets interpersonal problems, conflicts, and life traditions. This is a shorter term treatment, usually runs about 12 to 16 sessions, and was originally developed for depression, but is also shown to be effective at treatment of substance abuse and eating disorders. Humanistic therapy is another form of insight therapy that emphasizes the ability for humans to grow and develop, and the development of human potential, and the belief that human nature is basically positive. Humanistic therapy is a positive approach to psychotherapy that focuses on a person's individual nature rather than categorizing groups of people with similar characteristics as having the same problems. So, humanistic therapy looks at the whole person, not only from the therapist's view, but from the viewpoint of individuals observing their own behavior. The emphasis is on a person's positive traits and behaviors and the ability to use their personal instincts to find wisdom, growth, healing, and fulfillment within themselves. It also emphasizes the importance of taking responsibility over our lives and living in the present. Humanistic therapists work to help people overcome feelings of alienation, and to develop sensory and emotional awareness, express creativity, and it's aimed at helping people become more loving, responsible, and authentic. In the 1950s, humanism grew out of a need to address what some psychologists saw as the limitations and negative theories of behavioral and psychoanalytic schools of therapy. So, this was a new, holistic approach that focused less on pathology, past experiences, and environmental influences on people's behavior, and more on the positive sides of human nature. So, around this time, Abraham Maslow, who should sound familiar because we've talked about him before, developed a human hierarchy of needs and motivations. And fellow therapist Carl Rogers developed his person centered approach. So, humanistic therapy evolved from these theories. And humanistic therapists believe that people are inherently motivated to fulfill their internal needs and their internal potential to become self actualized, which, if you recall, can take on many forms, so creative endeavors, spiritual enlightenment, or pursuit of wisdom. Humanistic therapy is used to treat depression, anxiety, panic disorders, personality disorders, schizophrenia, addiction, and relationship issues. People with low self esteem who have trouble finding their purpose or reaching their true potential, or who lack feelings of wholeness, who are searching for personal meaning, or who are not comfortable with themselves as they are, may also benefit from humanistic therapy. It's a form of talk therapy. It encompasses a gestalt approach, exploring how a person feels in the here and now, rather than trying to identify past events that lead to these feelings. Additionally, the humanistic therapist provides an atmosphere of support, empathy, and trust that allows the individual to share their feelings without fear of judgment. So the therapist doesn't act as an authority figure, rather, the relationship between client and therapist is one of equals. Some examples of humanistic therapy are person centered therapy and gestalt therapy, which we'll talk about next. Person centered therapy, which is also known as Rogerian therapy because it was developed by Carl Rogers, originated in the work of American psychologist Carl Rogers, who believed that everyone is different and therefore everyone's view of his or own world and ability to manage it should be trusted. Rogers believed that all of us have the power to find the best solutions for ourselves and to make appropriate changes in our lives. Person centered therapy was a movement away from the therapist's traditional role as an expert and leader towards a process that allows clients to use their own understanding of their experiences as a platform to facilitate healing. Person centered therapy is another form of talk therapy where the client does most of the talking. But here, the therapist doesn't judge or try to interpret what's said. They may restate the client's words in an attempt to fully understand their thoughts and feelings. Now, when the client hears their own words repeated back to them, they may then wish to self edit and clarify. And this may happen several times until the client decides that they have adequately expressed what they're thinking and feeling. This client focused process facilitates self discovery, self acceptance, and provides a means towards healing and positive growth. The main tenet of person centered therapy is that it's non directive. It encourages clients to direct the course of their therapy, giving them more control over the topics that are focused on and where the session goes. This is in contrast to the earlier Freudian theories. In order to ensure a positive outcome in the session and treatment overall, the therapist must be genuine, authentic, and express unconditional positive regard, so acceptance of any and all feelings. And they have to show empathetic understanding to really listen and be present and reactive. They must also be reflective or mirror back the client's feelings as a way of providing validation. So the therapist's role is to be a bit more kind and supportive and empathetic compared to some of the neo-Freudian psychodynamic and psychoanalytic approaches. Person-centered therapy aims to increase awareness and foster self-acceptance, ideally causing people to think more realistically, become more tolerant of others, and engage in more adaptive behavior in their lives. So we're not going to watch this whole thing, but I do want to show you just a little bit of an example. So this is a role play scenario that is an example of person-centered therapy.
Okay, Max, I understand that you have some concerns that you'd like to discuss today. So whenever you're ready, I'm happy for you to voice whatever it is that you'd like to talk about.
Yeah, well, I suppose the bottom line is I'm having some difficulties in my relationship with my wife, and I'm very uncertain about actually being here, and it's a bit embarrassing talking about these things with a stranger.
Yeah, so you're feeling a little bit uncomfortable discussing such personal information with an outsider.
Yes, it is. I'm a bit awkward. I
Right.
was brought up to solve your problems yourself,
Yeah.
and you don't go outside the family, you don't take your problems to strangers. And I would normally do, but also I realise now that given the depth of the problem, that I also need to get another perspective on things.
Okay, all right. I guess what I generally say to people when they first come along is that it's not uncommon to feel quite uncomfortable talking to an outsider about such personal information. And even though I can't predict exactly how you're going to feel and how things will go for you today, I do know that in the past, a lot of other people have actually felt quite uncomfortable to begin with, but as they've been able to talk and get things off their chest, they actually feel quite relieved. So you might find that as we spend more time together, that you're more comfortable in this environment too.
Well, I hope it works out that way.
Yeah. We'll see how we go.
Well, there was a friend of mine who'd been involved in counselling previously who suggested that this is what I should attempt to do anyway.
Okay, so she's showing unconditional positive regard. She's being empathetic. She's non-judgmental. She is validating. She's understanding of their thoughts and feelings. She's not, she's acting like an equal. There's no air of authority or professional superiority. She's just kind of chatting back and forth and really validating what he's saying. So it's a good example of person-centered therapy. And you can watch a little bit more if you're interested, but let's move on for now.
Well,
The word gestalt means whole. So gestalt therapy was developed by psychologist Fritz Perls on the principle that humans are best viewed as a whole entity consisting of body, mind, and soul, and best understood when viewed through their own eyes, not by looking back into the past, but by bringing the past into the present. Gestalt therapy emphasizes that to alleviate unresolved anger, pain, anxiety, resentment, and other negative feelings, these emotions can't just be discussed, they have to be actively expressed in the present time. If that doesn't happen, both psychological and physical symptoms can arise. Pearls believed that we are not in this world to live up to others' expectations, nor should we expect others to live up to ours. By building self awareness, Gestalt therapy helps clients better understand themselves and how the choices they make affect their health and relationships. With this self knowledge, clients begin to understand how their emotional and physical selves are connected and develop more self confidence to start living a fuller life and more effectively dealing with problems. Now, Gestalt therapy is a client centered approach that helps clients focus on the present and understand what's happening in their lives right now, rather than what they may be perceived to be happening based on past experiences. So, this is another way that it differs from the Freudian approaches. Now, instead of simply talking about past situations, clients are encouraged to experience them, perhaps through reenactment. Through the Gestalt process, clients learn to become more aware of how their own negative thought patterns and behaviors are blocking true self awareness and making them unhappy. And in fact, because of this, Gestalt techniques are often used in combination with body work, dance, art, drama, and other therapies that let clients sort of live out or act out those negative emotions. And so this form of therapy can be helpful for things like depression, anxiety, self esteem, relationship difficulties. And good candidates for Gestalt therapy are those who are interested in working on their own self awareness, but who may or may not understand the role that they play in their own happiness and discomfort. So, again, I want to show you this a little bit of this video. They're using something called the two-chair technique, where they switch back and forth between two chairs. So we'll just look at a little bit of this.
Is it's really
Hi James, how you doing today?
I'm alright. I'm feeling a little off.
Feeling a little off today?
Yeah, I'm feeling jittery and I don't know. I just feel like I need to explode or something. It's just in there somewhere.
All right, so you almost seem like a little fidgety.
Yes. It's like my body just can't keep still, and I'm trying to make it, but it just won't allow me to stop.
All right, so I remember we talked a little bit about this last time. We had kind of the same feeling.
Mm-hmm.
So I had an idea for a day. Try a technique that I think might help you to explore, to get some insight at this jitteriness.
Okay.
It does require a bit of imagination, and you can see I have a second chair here.
Mm-hmm.
So what I'd like to do is I'd like to have you, James, have a conversation with this part of you that's making you feel fidgety and like you want to explode and jittery.
So this two-chair technique is a way for him to act out some of his negative feelings. So you'll see he's going to switch back and forth between the two chairs and almost engage in two different personalities as he talks to himself. So you'll see how that goes.
First, I want to be able to name that part. What do we want to call that part of you?
I think it's anger. I think it's anger.
I think it's anger.
I think it's anger.
All right. So this is the angry part of you.
Yes.
And that's causing, it's kind of erupting through.
Yeah.
Causing this feeling of incongruence.
It's making me feel like I'm not being my true self, or just fully me.
You should be inauthentic.
Yes, you're right. I'm being inauthentic with myself.
All right, so let's separate out this angry part of you.
Okay.
All right, so here where you're sitting, I want you to be James.
Okay.
But in that chair, I want you to imagine, best of your ability, that the angry part of you is seated there.
Okay.
All right, so it's really only going to see things from that perspective. It is the angry part.
Okay.
It's not the whole, it's just a part.
Okay.
All right, and I'm going to have you move back and forth as needed so you can have a conversation with. All right, so that's a powerful message you've communicated to the angry part of you. So I want you to think, how's the angry part of you going to respond to that? And then switch seats and respond back to James. Make sense?
It makes sense.
Okay, I think you get the idea. I don't want to kill too much time on this, so you can continue to watch on your own. But the point that I want you to take away is that the doctor is seeing James as sort of his whole person and encouraging him to embrace the different aspects of himself that are causing problems and to act out the process of working through those negative emotions. Now, when looking at humanistic therapies critically, the core concepts can be kind of difficult to falsify. So Rogers' 3 conditions, remember, unconditional positive regard, open relationships, etc., they're not the only ways to achieve improvements in therapy. But the idea of establishing a strong therapeutic alliance has been very helpful and useful. It's important that the therapist and client have an open, healthy, and truthful relationship. And that component of humanistic therapy is recognized and used across other domains as well. Humanistic therapy also has some mixed results in terms of its effectiveness. So some studies have found it to be more effective than no treatment, but others have shown that it's not any more effective than a placebo treatment. But the focus on the therapeutic alliance, on the client-therapist relationship, and having it be a strong, healthy, and open relationship is overall beneficial and useful. So I think that's the important takeaway from humanistic therapy. So in the next section, we'll talk about behavioral approaches, but also cognitive behavioral approaches.